set it up quickly. The chamber itself, the chamber is an auto-fill chamber, so we can spike a bag, but if you need to use it quickly, you can manually fill some small amount of water into the chamber. There's a maximum fill level on the chamber. So we connect the chamber, we connect the humidification lamp, and then we connect our heater wire limb. We need power for the heated wire, and for the humidifier to work properly we need to measure the heat at two separate locations. So we need to measure the heat coming out of the chamber, we need to measure the temperature at the patient end. The humidifier will then adjust power going to the wire to achieve the necessary heat increase from here to here, and to keep the moisture as vapor and not water. What application are you using the high flow for right at the moment? What are you using high flow for? What type of patients are you using the blender high flow for?
For the bronchoscopy also.
From bronchoscopy?
Yeah.
Okay, so you're using it, so there's no
In the wards,
saturation.
it depends. Who are not tolerating CPAP, then we are using this one high flow.
Those are not used to or comfortable with the CPAP. They need oxygenation. They are using it.
Actually, in this ward, we are putting it for the bronch.
Okay.
Usually because the patient needs more oxygen while doing the bronchoscopy, so it is more comfortable.
Yeah. So
Basically, it's up to the doctor.
Yeah,
He's the one who decides, and we just put.
Sometimes
But
they
for the
don't want to
oxygenation
use
purpose, those
continuously
who
the
are
CPAP.
comfortable with the CPAP,
Yeah.
and for to improve the oxygenation, sometimes they do put for the pre-intubation,
yes.
because the patient is very he's very desaturating and needs something extra like this.
So for the pre-oxygenation side and using it during procedural sedation, pre-oxygenation, we have a mount that was designed specifically for it. If we leave this, we can see on the bottom of the device there are two modes. The high flow oxygen therapy point. This is the same. The only difference is point. It's named point for perioperative insufflatory nasal therapy, a long name, but use within the operating department, use within bronchoscopy, for example. The difference between high flow mode and point mode is the flow can be higher in point mode. So in high flow mode, the flow maximum is 70 litres per minute. In point mode, the flow maximum is 80 litres per minute. High flow oxygen therapy mode is intended for awake, spontaneously breathing patients. Point mode is not. Point mode is
Kind of a sedative, semi-sedative patient.
semi-sedated or completely apneic patients.
What will be is completely apneic.
Apneic. So what this was used for originally, it was used within ENT, and it was used so they did not have to intubate patients. So if you pre-oxygenate the patient with 100% oxygen, high flows, you clear out the upper airways, you create a reservoir of oxygen. Whenever the patient is apneic with the high flow, you can continue to oxygenate the patient for a long period of time when they're not breathing. So they call it aventilatory mass flow. So it works over mass flow. So as oxygen is being depleted in the lung, it's creating a lower pressure. We've got a higher pressure here. It draws oxygen down, and there are papers which are showing this can be used for 45, 55, 65 minutes. There's a lot of evidence on that. But if you're using it for bronchoscopy, then the benefits that you have in using the high flow, you would give some pre-oxygenation to start with, While the bronch is being performed, you continue to keep the high flow nasal cannula in place. You have a high flow of gas. The patient's respiratory rate's probably going to drop, the tidal volume is probably going to drop. So what you will be doing is you're washing out the upper airways, you're clearing the CO2, and you've got a higher concentration of oxygen in the upper airways. So whenever they're taking smaller breaths, less breaths, they are still getting a higher level of oxygen.
Enough amount of oxygen.
So heavily sedated patients, you could use this so they're not desaturated. The cannula itself, which you would have used, we have bilateral application, so we can change the orientation depending on which side the machine is on. Within the side that is open, we have a ductile valve, so with flow going that will close. This is not the original package, but in the original package we also have some sealing caps. Sealing cap is not required, but if you want additional, you can add the sealing cap. Comfortable with the humidifier and the settings on it? Okay, then I'll simply show you how to change the flow. If we come back out and we go into the menu, depending on the application, if our patient is in the ward, spontaneously breathing and awake, we'll select high flow oxygen therapy for the low flow, because it's probably likely that the highest flow that they'll tolerate when they're awake is probably in and around 60 litres for a man. Maybe less for a lady. If we're using it within bronchoscopy, we're going to select the point mode, select your oxygen concentration, whatever is prescribed. I'll put this down to turn away for the purpose of display. The point mode defaults to 30 litres per minute. It's a good place to start. If you start the flow low, then the patient gets used to the sensation of the heat within the circuit, the sensation of the gas flowing. But if you're pre-oxygenating, you want the flow as high as they will tolerate. You get the most benefit out of the higher flow because of the CO2 clearance, and also there's less dilution of the air if you're achieving the peak respiratory need of the patient. So we start at 30 litres per minute. We have the cannula connected.
And do we have to switch into peds mode or adult mode, or it's like we can go directly and put the pressure lower in peds?
In peds,
Like,
no, you
yeah.
go lower.
Because other high flow has two modes, adult mode and peds mode.
Okay.
So I'm asking you this one, does it?
Our flow range, so this device can be used for neonates, peds and adults.
Yeah.
But in the high flow mode, in either of the modes, the point mode or the high flow, so in point,
It can be decreased to 10. Yeah.
10 litres per minute.
Okay.
If you need lower than that, you can go into the high flow mode. It will go down to 2 litres
Sure.
per minute.
Mhm.
So depending on the patient, you can adjust the flow and you can
Mhm.
have a lower starting point.
Mhm.
So